I'm excited to introduce our guest today, Dr. Maria Muzik, University of Michigan professor of psychiatry and an OB-GYN. That's right, folks. This is something incredible for our podcast. I don't believe I've had someone with quite the credentials that we've had a chance to interview here. And this is in our series that's very important about, rural maternity. The other great news about Dr. Muzik is that she's co-director of Zero to Thrive and Strong Roots program, medical director of psychiatry, reproductive psychiatry, and medical director of the MC3 Perinatal, co-director of parenting for the Future Clinics, and the list goes on and on of all of the work that she is engaged in, and certainly a trailblazer, someone who is making a difference in the state of Michigan. And I say Michigan, but ultimately this is a national podcast, but throughout the country, the work that Dr. Muzik is doing in Michigan is impacting the lives of many people. And so we're excited today to have Dr. Muzik with us. And let's first start, for those who may not know you, like I don't, I've had a chance to look at some of your work and to listen into some of the work that you've done with my colleague here, Kirsten. Why don't you tell us about the role that you serve and how you're really facing some of the challenges around perinatal and maternal psychiatric health? And how long have you been in this industry and this business working? And this is, I'm going to say, this is kind of a niche type service. I mean, I don't think maybe you woke up one day and said, this is what I want to study, but it sounds like maybe your path has been led to this. And if you could just share a little bit about the why, I would appreciate it.
Absolutely. So first of all, thank you so much for having me. It's such an honor to be with you and to talk to you all. So, I started my work as a psychiatrist 4 decades ago. I actually was a young doctor, psychiatrist in Austria, and I cared for a mom there with serious mental illness. And it was really a humbling experience. She was struggling, I was struggling, the baby and the husband, we all were in it together. And I think I learned a lot, and it just sparked my love for this period of time, but also the struggles. And so with that, I actually then came to Michigan in the 1990s to advance my learning. As you know, Michigan is the birthplace of infant mental health. There was a person called Selma Freiberg who started here a relationship-focused, needs-driven, multi-component intervention called infant mental health. And I wanted to learn about it. I wanted to embrace it. I came here. It has a psychotherapeutic, a relational component. Well, that was in 1997, and I've never left. I fell in love with Michigan and with the work here, and I have been working in this area and in this field now, really looking at the early relational beginnings of our family life and our children and the moms and the dads from this perspective since. And I tackle it really from every perspective. That's, I think, the beauty of this time period. Perinatal, that is preconception planning, thinking about who am I going to be as a parent? What do I want for my children? Who was I growing up? That's preconception. And then there's pregnancy. So much happens there during this time period, biologically, emotionally. Then there's birth. What an experience. Can talk more about it. But then postpartum with the birth of the child, if the family is lucky, and sometimes there is loss, but with the birth of the child, this first year is such a tremendous period. And that's perinatal. That's the time period that I really honed in my career.
What an amazing background, and certainly bringing all of your disciplines together. I mean, I couldn't think of really a better background to be able to present and especially to do some research and then provide resources for this population with your background in psychiatry. By the way, Austrian, I studied under Austrian economist Ludwig von Mises, and so I studied his writings and was part of that club at my college. But certainly your experience in Austria, having spent time in psychiatry and understanding, the value of the wholeness of the person from mind to body, and there's all types of aspects, even from spirituality, that impact. And the conversations we've been having in this series has been around wellness for moms and babies. And ultimately for the wellness of families. And so your background lends that. And I'm so excited to talk today about some of those experiences that you've had and really about some of the initiatives and work and some of the resources that are available to moms who may be listening now or families who may be listening, have that conversation. But before we begin and dive deep into that subject, I think you've already told me, some very fun facts about yourself. But if there was one fun thing, about you or interesting fact about you that really can kind of culminate in the hearts and minds of our listeners across the country, what one fact would that be? Now, you've already told us you're from Austria and you've done all those great things, but would you have kind of one thing?
Yeah, well, as an Austrian, you would assume that I'm into mountaineering, skiing, nature, hiking. All of that is true. So when I came here, I had to kind of shift a little bit. I still do the hiking and mountain biking and, water sports, but I really fell in love with ice hockey. So I am a big ice hockey player because that's what we do here. And I'm a big, hockey fan. I play myself. I'm a center. So I'm also kind of physical out there. So I love it.
So is this an official team or is this kind of just something you do on the side?
It's a leisure team now for ladies. I played for the last 15 years. Initially more competitive, but now more leisurely.
Yeah. So are the Detroit Red Wings scouting you to see if they're going to maybe have a new player?
Well, I love the Red Wings.
Maybe not, huh?
I am a big fan of the Red Wings. So
Oh, that's awesome.
yeah.
Well, that is so incredible. We relate to people, right? When we get, down to a level where we can just humanize. And so that is so incredible.
And the best thing is when I teach quite a bit across Michigan. I go up north. I love it everywhere. But I connect over hockey with all the other hockey moms and with the teams.
It's fun.
It's just fantastic.
Yeah, our son went to Lake State up in Lake Superior State University, and they have a huge hockey program. And so we had a chance to watch that and participate. And it's really, the community comes together. They support it, and it's a fun event. So great to know about you. Well, let's get into the heart of some of the issues. And for our listeners, if you're just tuning in, today we're talking about perinatal psychiatry and a collaborative care approach. Dr. Muzik is here to share her perspective and insight as a leader and teacher in this field. We'll talk about mother-infant relational health, maternal post-traumatic stress, and of course, what does all of this have to do with rural health right here in our country? So let's first dive into defining by what we mean when we say, perinatal psychiatry. What does that even mean? Why is it important for us to focus on this specific stage of mom and infant health? Let's start there.
Yeah. Well, perinatal, as kind of defined, it's really this amazing period of time from preconception to pregnancy, birth, postpartum, and usually we say the first year of the child's life, although you could say it's up to 2-3 years, but the definition is 1 year postpartum. And this is really a special period because it's a special period for the mom, of course the child, as well as the family. It's a time of joy, hope, new beginning. And yet it's also a time of vulnerability. And
Right.
the vulnerability is based on, biological factors. There are hormonal changes. There's physical exhaustion. There is emotional exhaustion. There might be triggers that happen during prenatal care that are reenacting previous experiences of trauma, loss, that might be reenacted. And so it's also a time of potentially painful birth. 30% of women say my delivery was traumatic. So that might be new onset opportunity for mental illness. It could be either a aggravation or re-triggering of pre-existing condition, or it could be new illness emerging. So we have to see it balanced. It's a time of joy and ease and love and connection, but it's also a time of vulnerability. And then the additional piece is it's also the time of new beginning for this new life, the first in utero, the unborn baby that is already shaped by prenatal experiences. We have good research to suggest, and I contributed to some of that, how prenatal stress, glucocorticoids, so stress hormone, impacts baby's development in utero, but then also after the birth, the parenting journey, the entry to parenthood for mom and for the dad. This is a time of challenge potentially, and it's at the same time so important for the baby, because while we are all hardwired to be connected and relational, it's the quality of these early relationships that are building the blocks for our lifelong health and resilience. So if the early relationships are secure and stable and predictable and loving, you have a good launching pad in life. Whereas if you experience early adversity, it's a risk factor for lifelong less health and illness.
So we'll talk a little bit about what resources are available for moms, because we don't get to live in that perfect sphere where all those things come together. And sometimes, that burden that shifts to mom, and the challenges of being a new mom or having the experiences, when you say triggers, maybe it was a very tough delivery. And then, obviously post maternal conversations with family members. Everybody has their own ideas about, this is what you should do. This is how you can get better. And we'll talk a little bit about what resources might be available or is available for moms that may be going through this. But, let me ask another question. How does, that mother-infant relationship play a role in their health? So the relationship between the baby, the mom, how does that impact the health?
Well, really, the early relationship between the parent and the child, the parent, mom, dad, and the infant is tremendously important. Everybody plays a different role. Everybody has a unique relationship. But it's foundational for lifelong resilience and health. And in my work, really, this is the core that I support. Despite all adversity, you're absolutely right. This is so important. I don't want to sugarcoat. More people than not have some adversity, whether it's pre-existing, you bring it from your childhood experiences, your life experiences, lack of resources, lack of supports, you're lonely, you're isolated, you have pre-existing mental illness. That is all real. So we need to address this. But despite all this, what is really important that you as the parent are providing here the nurturance for the next generation. And I use the symbolism of a tree. Like trees that grow strong and branch and develop in life, right? And become strong branched and have a strong trunk. Well, they only can do this when they have strong roots. And the roots are symmetrical to the branches, right? Trees are symmetrical, otherwise they topple. So similarly to a child's growth and development, like the branches of a tree, you need strong roots. And the strong roots are your early relationships with your parents, your family, your community, your people. That is what holds us. And the soil, that's our community. That's your surrounding. That's your value system. That's who you are and who your people are. And that's what I'm building. All my programs are designed to support those roots and the soil.
Yeah, and you're doing a fantastic job, identifying some of those challenges, but the opportunities to grow those roots. And that's through some programs, which we'll talk about in just a minute. But Dr. Muzik, you and I both know that we shouldn't be talking in 2025 about all of the barriers that we have in healthcare, but there are so many. Disproportionate number of patients on Medicaid in communities that are rural, which Medicaid right now is on the chopping block, which is going to dramatically impact, the wellness of our communities. It really is. But beyond that, we're having dialogue and discussion about, what are the barriers? If we think the barriers are bad now, eliminating $880 billion out of the Medicaid budget isn't going to make barriers any easier. In fact, they're going to become a little more difficult. But, talk to me a little bit about barriers to moms and infants receiving proper, perinatal psychiatric care. And, we experience, like I said, that disproportionate number of patients in our rural communities that are on Medicaid, lack of transportation, and so they can't get to appointments, and then access points, right? Like you're really in a niche service because we don't have anyone of that caliber of education and expertise in our community. So could you please first describe the barriers? And then the second portion of it is the tools and programs that you have seen successful in addressing these barriers, if you could.
Yeah. And I want to start with, you are absolutely right. It's painful. It's painful for me to anticipate the challenges that are ahead of us. And yet I also think we will have to work hard to overcome whatever is in front of us. So let me tell you what I see so far, what the challenges were all along, and what some of the things are that I have started or implemented or collaborated with communities to overcome these problems. I see a big problem is awareness and kind of what we call primary prevention or health promotion. Already understanding that this is a time period that has joys and wonderful aspects, but also challenges, and that there is a real risk of mental health issues, suicide, substance use, depression. All of this is real. So we need to educate providers as well as families alike. And that's one of the programs that I have created, this MDHHS state-funded program called MC3 Perinatal, where we provide education to providers like your doctors in the rural community, in the offices, in the hospitals, where they can basically have a lifeline. If they feel like something, I'm not sure what to do here, I don't know what the resources are, they can just call us and we are the lifeline and give education, training, programming, and support. That's a free of charge service, and I hope it will stay around despite all the cuts. So that's one. But the other piece is that similarly, if a mom feels like I don't feel right, I need help, and she identifies the need for help, she needs instant access to help. And that is not that she has to drive an hour to get it. So we created this instant access therapeutic connection, like a rapid response connection, where a behavioral health consultant is on the phone and helping her on the spot with whatever she needs, resources, counseling, connection to other services. Again, do I hope that this program will stay around? Absolutely. But the piece is, you already identify what I see as one of the major factors that is hurting us all. It's the social isolation, loneliness epidemic. You know, in 2023, the Surgeon General then, Dr. Vivek Murthy, already said this is what hurts our population. And in fact, 60% of new parents say, I am alone, I don't know what to do, I'm isolated, particularly in rural communities. So I believe that we need to build connections where there are already natural connections, social groups, church community, social circles, moms groups. Strengthen those, empower those, whether they are formal, you have centering pregnancy or therapy group or access to a virtual therapy group. That's one, that's great. But also these informal groups, strengthen those, because that's our, I think that's our strength. We connect with others and supporting those. So I created a program called Strong Roots Parent Cafes, where we create safe spaces for people to come together, either in person or virtually, and where they can communicate, exchange ideas, and support each other in this entry to parenthood. And if need help, they can come back to a more formalized program like the perinatal clinic that I guide, or formalized therapy groups. But social connections, and that's the power in the rural community. People come together.
You know, it's a great point, and something that Hillsdale took upon ourselves years ago with starting centering. And it has been wonderful to watch. We've graduated several classes. It's been great to see the connections that have continued among moms after that, and in the relationship of communication and sharing stories and having someone to lean on, because that is so important. In fact, it's led us to look at centering for pediatrics right now. Same type of support services for moms post delivery and growing that child and raising that child. It's important to have those connections. And I think your message here is on point. It's not that there are resources that are available. If you can't drive, you can call a hotline. That's great. But then reach out to your community support programs. To your point, churches, civic groups, centering. Talk with your primary care physician. Talk with your OB-GYN. I think you yourself would say that is the natural course of conversation. Talk to your primary care. A lot of, what we find moms, post-delivery, in the challenges that they face is that they aren't sharing their story, and that they're not willing to reach out because they don't think those resources. But I think you would submit, Dr. Muzik, the same as I would, that there are resources available locally in our communities. Starts with your primary care. Have a conversation. They'll redirect you. Go to your church group and say, hey, I'm struggling. And you will find those resources. I think that is an important aspect of tools that can help us in these barriers. And I think, if I can get on my soapbox for just another minute, the cuts to Medicaid that we're projecting of $880 billion are going to have impacts on programs like you've just described. It may reduce the availability of a call center, whatever it is. I want our listeners to know that the resilience of us as people and Americans is that we are going to be able to get through this. I don't like it, but that the resources are still going to be available. You have to search them out maybe a little bit more, but to start with your primary care, I think, is a good place. I'm sure in your practice as an OB-GYN, you've seen that moms have very desperate situations, have nowhere to turn. They are seeking you out for counseling and advice. what would you offer to your colleagues who are listening today? And we have OB-GYNs to physicians across the country that listen to this podcast. We know it. What would you say to them to give encouragement to their population?
Well, I really believe that the key is our systems have pushed us to, particularly in OB and primary care, shorter visits, just zoom onto the physical. And there is no space for connecting or that personal. And I think we need to get back to the basics, that we also train our providers in addition to, doing all the due diligence that they do to the physical, all the checkups, particularly in OB, where you have all the things that you need to address, that you intersperse that personal connection. And so I am teaching OBs, primary care, pediatricians, how do I introduce this relational health, like we call it relational health aspect, so that I connect and I open the door that the mom can say, actually, I am struggling. Actually, I don't know what to do. And then you can identify those who need more. And that's where you move them to a higher level care. And I think there will be we will have to have a staged care approach. So everybody gets that warm touch. Some get additional toolkits. I'm creating toolkits for moms, do it yourself. How do you practice resilience by yourself, whether it's app-based or over the phone or videos that I create. So things that the mom can do on her own, with the baby alone, with the partner. But then the next step, we have to identify those where we need more, and those need to be then referred quickly to help. And that's what I'm trying to create, this staged care model. We know how to do it. We just have to do it more efficiently and invest resources to those who need it the most. And everybody needs to get the basic relational health support. And that's not rocket science. That's just being human and kind and connecting to our roots and connecting as people to each other.
Yeah, great perspective, Dr. Muzik, and certainly something that our providers who are listening to this can, I would say, I'm not going to say sympathize. I think I don't think that's an appropriate word, but that they can really understand the depth of what you're trying to say, and those personal connections that those providers can make for those patients can be the difference between, in some cases, life and death. And we find this to be very, very important, in the wellness of a mother. And, let's transition and talk a little bit about, we often have heard, most recently for me, as we've really engaged in this series, maternal post-traumatic stress. And I think it's worth just stopping here for a minute to have that dialogue. I know we don't have much time, but I'd really like your perspective. How does this affect the infant's health and the family as a whole, in addition to the mom with this post-traumatic stress? And what are those post-traumatic stressors?
Yeah. Well, post-traumatic stress is a very defined kind of set of symptoms and presentations that comes along with being exposed to high levels of stress or trauma that you either carry forward across your life because you had childhood trauma and stress experiences that already weakened you or made you vulnerable, or because you have stress and trauma in the here and now, be it violence exposure or just being, extremely stressed out about resources. And so the set of symptoms that you experience is really heightened anxiety, panic, being triggered by, kind of stressful events, so that you are in a hyper-vigilant, hyper-aroused state. You can't sleep, you can't relax, you're tensing up, and your body takes a toll. And that's why then it comes along with a lot of physical ailment like premature birth and maybe even some other bad outcomes for the baby, and with self-medication. So many of the moms that I'm working with, particularly in this Partnering for the Future clinic, who have had so much stress and trauma in their life, they kind of lean into self-medicating with some substances that are initially calming, but unfortunately it's a vicious cycle, because the more
Very
you're
vicious.
using those substances, the more you actually, derail from a healthy path. So I think post-traumatic stress is actually getting more and more common. We have moms who have one single incident of traumatic event and they might experience these symptoms, and we have moms who have had lots of trauma and stress in their life and they might have it chronified. But it's really important that we identify the signs and symptoms and then understand that it comes often as a package together with depression and substance use and other social determinants of health, smoking cigarettes and maybe other substances. And that package, to identify early, non-shaming, not punitive, but supportive. And we have good treatments. But this is definitely a group of individuals that need our utmost support, because it does have a longitudinal impact on the baby and parenting and lifelong outcomes on the kiddo.
Yeah, I mean, the decisions and the issues faced will seriously have a lifetime impact. And so capturing early on, identifying any of those triggers and having conversations are key. And we're going to put in the show notes available resources to moms and to families that will be available for them. And those are going to be resource guides, including yours, that can be available. The time has come, but I have to ask one more question. For my CEO friends that are listening to this podcast across the country, what would you say to rural hospitals and their executives? What can they do to provide better psychiatric care for moms and infants in this phase and beyond? And just remember, we're taxed with all of these challenges of serving a disproportionate number of Medicaid patients in rural communities, patients with no pay, patients coming in, with no prenatal care because they don't have the insurance. They did not get it. And so what available resources and do you think hospitals should be providing? And challenge us. Give us a good lesson here, okay? You can yell at us and tell us what we should be doing to better serve.
I have to say, I'm far away from yelling. I'm utmost admiring. It's a challenging time, and the providers I work with, because I'm consulting across the state with all the providers in rural hospitals and they are doing an amazing work, and they are right there. They have the heart at the right place, and they are skilled, and it's a challenging time. I think that I would go back to what I said before. As the resources will get tighter, and it will be less, possible to refer locally to a social worker, clinician, and there will be less transportation, and all of this is true and might get harder. I think the personal touch, the connection, that even 10 seconds, I hear you, I'm here with you, I am your doctor, I understand. Let's think together and let's brainstorm together. So that listening, awareness, and joining in the mom in her struggle, and then having one resource that you identify in your community, be it a informal group, being the local counseling center, or being our MC3 line. That will not go away. I am crossing my fingers, but I think that the support to the providers will not go away. And that is something that the providers, the doctors, the nurses, the midwives, the pediatricians will have at their availability long term. I think that that's my, and that we are in Michigan having these kind of consultation lifelines with resources that then can be passed on to the patient. And this is across the country in other states as well. So I think we are all joining in this idea. We need to support the frontline providers and give them the tools, the training, the resource lists, and maybe one local resource that they can go to and refer to. That will not go away.
Dr. Muzik, I love your passion and your purpose, and you are, bringing those two things into the third P, which is practice. And thank you for doing what you do, for advocating for families, for babies, and just really being that solid voice that there is help available pre and post delivery, and that resources do exist in your community, even though you might not be able to Google them and see it right in front of you, or that there are resources that are available and programs like what you're engaged in. And again, we're going to promote those to our community and have a conversation about what is available beyond just your normal visit to your OB-GYN or your pediatric psychiatrist who's on staff that may have 15 minutes, but what resources are available long-term that will help families be more sustainable into the future. And so your purpose and your passion is amazing. Your practice is phenomenal. And just what you've brought to Michigan in not only the provider side of it and the care that you can provide, but really just forming these opportunities to say to moms and to say to families that you are not alone, that there are resources, because after all, it can, in rural communities where transportation's a challenge and you don't even have, in some cases, cable, it can be very lonely. And so having resources like you have just offered are so critical. So thank you so much for your purpose and your passion and putting that into practice. It's been great to have you today. And we always wrap up with our segment in Rural Health Today with an important closing segment. It's called Rural Health Recommendations. And obviously you have the leadership. You've been doing this both as a psychiatrist and then OB-GYN and now researcher and presenter. You have a great wealth of information that you have and it's in your background and education and training. And for every guest that we have on the show, we like to tell our younger generation of leaders and providers and practitioners that this is what you can do. And so what I'm asking you for is what's called the rule recommendation. What sage advice, what tip would you give to a new leader, a new provider who's trying to make it in the world of rural health today? Maybe it's some sage advice on how to thrive in that rural setting. Whatever it is, we post this on our online guide that's available on our website at ruralhealthtoday.com. So Dr. Muzik, what is your rural health recommendation today?
I think the key is for anyone, maybe in particular when you are in rural spaces where loneliness and social isolation might be a big key. If you are a provider, if you have a chance, create spaces for social connection. Take the extra 30 seconds, 1 minute, and ask about who are you, what's going on in your life, how can I be of help? Open yourself up as a provider, as being that safe space where someone might confide in you, because that's the key. We can do a lot if we are opening ourselves up as providers to be that first landing place for someone who is struggling. Then once they open up and they confide in you, you don't have to solve it all. That's where you can call MC3. Ask me, call me. I'll figure it out with you. What is our next step? But that connection, it's the first landing place for anyone, and that can be done in your spaces, in the hospital, in the community. Just reach out to that person and say, what's going on for you? I think that that's the key.
So you heard it here. You can be that voice. You can be that first stop that can make a difference in the lives of your community members, wherever you are. And as a national podcast, folks are listening across the country in rural communities, even much more rural than Hillsdale County, where transportation access and amenities do not exist, but the availability to reach out to your provider does. So Dr. Muzik, it's been great to have you on the podcast today. I look forward to having you back here very soon to talk about, some of the work that you're engaged in after we get through this funding crisis and talk about what does a new model look like? What are the resources available for us? I'd really like to have that dialogue and that discussion if we could. And then thank you to our listeners, for listening in today.
Thank you so much for having me. I look forward to more. All the best.
Absolutely.
Well, thank you so much. It's been great to have you on the program.